Hi guys, I'm Dorothy Yip. I'm a practicing PA in California, specializing in ENT, ear, nose, throat, and internal medicine. I'm just making this video to go over some common upper respiratory and lower respiratory symptoms with you today in hope that I can essentially help triage your symptoms if you're experiencing any of them, so you can kind of tell the difference between typical seasonal allergies versus common cold, and also symptoms caused by the seasonal flu. And I'll make a second video later on that will talk specifically about symptom of COVID-19, so that you guys can kind of have a sense if you're experiencing any of these symptoms, which illness you're really dealing with, and also some of the common treatment plan for each of them. So I'll start with talking about seasonal allergy. So seasonal allergy, typically the symptoms that will come up are um, nasal congestion, runny nose, itchy eyes, a lot of itchy eyes and watery eyes, a lot of sneezing, and sometimes also post-nasal drip, which can sometimes cause a little bit of a cough. But you would expect that typically the mucus are pretty clear and maybe just a little light yellow, but typically pretty clear. And also another telltale sign is if the symptoms, you can kind of think back every year around springtime, which is right now, that you have very similar symptoms. And if that's the case, majority of the time you're dealing with seasonal allergies, and what you can do in terms of treatment actually most of the time don't really requires you seeing any doctors or other healthcare providers. You can try over-counter allergy medicines such as Claritin, which is loratadine, the generic name, Zyrtec, which is cetirizine, um, and Allegra, and also nasal spray, nasal topical steroid, including Flonase or nasal cord. Those are all products that are now over counter that you can certainly utilize. And my recommendation is, if you notice allergy symptoms, start using those products daily, consistently, at least for a couple weeks, because those medication does take time to ramp up in the system. So if you use it one day and then not the next couple of days, the effect are not very consistent and effective. So if you notice those type of symptoms, definitely try those products. And obviously, if after 5 days of consistent use, you still feeling the symptoms are getting worse, then we're probably not dealing with just allergies. But in order for the symptoms to be very obviously getting better, again, it can take a full 2 weeks of daily use of those allergy medicine for you to really start noticing really obvious improvement. The next category I want to talk about is the common viral cold. And viral cold is what we call common cold essentially, and it's not something that you need antibiotic. And the common symptoms you can expect some sneezing. You might even have a low grade fever of something that would run under 100 degrees Fahrenheit. Cough, typically the cough would be kind of mucusy. Um, and you can feel a little achy, but shouldn't be significant joint pain. Usually the course of a viral cold, what happens is you'll start out for a couple of days of sore throat, and then you start feeling there's a lot of mucus protection that start causing some stuffy nose, runny nose, and before you know it, in a couple of days after that, you'll start having a cough. And typically viral cold, it runs about, by itself, if you don't do anything at all, it runs about 7 to 10 days. And again, antibiotic is not going to help resolve the viral cold. And obviously, if your symptoms are getting worse after those 7 days, have higher fever, so on and so forth, then again, at that point, you might want to check in with your healthcare provider or urgent care. But in the current situation with the shelter in place order, at least in Northern California, most of the urgent care and even your primary care is going to require a phone screen. So make sure that before you want to make an appointment, do not do walk-in. Make sure you call your local urgent care or your primary care office ahead of time, so they can fit you in on the schedule accordingly. Or they most likely, including the practice I'm at, we're doing telemedicine, meaning we'll do video appointment or phone call appointment to help you with that. And typically, the treatment that really help with common cold, luckily, usually all involving over-counter medications. Also, if you have a lot of mucus, certainly consider using something like Mucinex. And Mucinex, the main component is the guaifenesin, and it helps you to get the mucus out easier. Also, make sure you drink a lot of water, just water, not Gatorade and things like that, um, to help thin out the mucus so you can get it out easier. And obviously, you have the choices of things like Dayquil and things like that if your cough is significant and you really need something to suppress the cough. But if the cough is pretty mild here and there, actually, there's some benefit of just let the cough happens, because the cough is a mechanism for your body to expel the mucus, which in general is good for the overall recovery. In the meantime, with the COVID-19 happening, there is some information suggesting that medication like ibuprofen, Aleve, what we consider NSAIDs class of medication, seem to might have some effect in diminishing your body's ability to fight the COVID-19 virus specifically. So if you have body aches or headaches when you're dealing with a viral cold, please consider using Tylenol, and generic is acetaminophen instead. And again, those would be over counter. And um, last but not least, we're going to talk about the seasonal flu. Usually, comparing to the common cold, seasonal flu had a very fast and furious onset. As soon as you get hit by the flu, you get fever. Sometimes it can run about, usually runs about 100 to 102 type of thing. You feel a lot of body aches, and you'll have a cough that typically is usually more dry. And you can have runny nose or stuffy nose, but that's actually a little bit less common than your allergy and viral cold situation. Usually in adults, you're not dealing so much with diarrhea, but especially in children, you could. Uh, in terms of clinically, I certainly have seen patient with flu getting loose stool more so than actual watery diarrhea. Sore throat can happen too, but typically it's the result of you coughing so much versus with viral cold. Usually the sore throat comes up first. Um, and with flu, obviously, if you have gotten the flu shot, even though you can still get the flu, luckily for you, the duration and the severity should be less comparing to if you didn't get the flu shot at all. And typically, a flu episode lasts about 7 days. After 7 days, you can still have that lingering cough that can last a while. But in terms of you feeling really bad and having fever, typically is about 7 days. Um, Again, with seasonal flu, antibiotic does not help. And there is benefit if you contact your healthcare provider if you feel like you're really having the flu symptoms within the first 72 hours, because if you were given um, antiviral medication like Tamiflu within the early onset period of the flu episode, the duration and severity of the flu episode will lessen, including the symptoms would be a little bit less severe. Again, comparing to a typical cold, viral cold, the flu, you will get higher fever, typically over 100 degrees Fahrenheit, and you will usually have less of the stuffy nose, runny nose issue, and the sore throat typically is not the early symptom. It's usually coming later in the course of the flu because you're coughing so much. And with flu, very similarly, besides possibly uh, getting a hold of your provider for antiviral medication. Actually, if you miss that, that timeline, or even maybe you don't have a way to get access to that antiviral, even though yes, it's very uncomfortable, but the flu will pass after you just use some over-counter medication to help with the symptoms. And typically, very similar to the viral cold, if you have a lot of mucus, use things like Mucinex, which has the use the guaifenesin, which help you expel the mucus. Use Tylenol for fever control and for body aches and headache that comes with the flu. You can still take any sort of over-counter cough suppressant like Robitussin for the cough. And so, yes, if you just do over-counter medication, your flu will still pass, but sometimes having a prescription of antiviral, such as Tamiflu, will help you lessen the duration of the flu. And also, the symptoms typically would be a little bit milder if you have the antiviral medication on board. And just a quick reminder, yes, right now it's pretty late in the typical flu season to get flu shot if you look at other years. But in this current situation with the COVID-19, the CDC actually recommend that you guys still go ahead and get the flu shot if you have not already. The reason being that flu virus is still circulating in the community, so you can still get the flu. So getting a flu shot will still help. And second is because the COVID-19 do share similar symptom with flu up to a certain extent. Um, so if you have more protection from getting the flu, the less likely you'll end up needing to show up at the urgent care or ER trying to get tested for COVID-19 when what you really have is just a flu. So hopefully all of this information kind of give you a brief idea of what to look for if you start having just sniffle or cough, so you can kind of triage yourself to see if it's more a seasonal allergy thing, a viral cold thing, or more of a seasonal flu situation. But the most important thing to remember is this is just a very general recommendation. This is in no way to replace your own personal healthcare providers, assessment and treatment. So if once you feel like the information discussed in this video is not starting to not quite fall in line with what you're experiencing, or you still have questions, please do reach out to your local urgent care or your primary care doctors to discuss more on your specific case. And like I said earlier, I'm gonna make a COVID-19 video in just a second, and that will again go over COVID-19 symptoms, what make it stand out a little bit different than a cold or flu, and also the what is to expect in terms of management of the COVID-19. But the most important part to remind you guys is because of the overwhelmed healthcare system, the shortage on COVID-19 test kit, and an overall general overwhelmed healthcare provider, please know that if you feel like your symptom falls under seasonal allergy, common viral cold, or seasonal flu, and even if you suspect you might have COVID-19, the best thing to do at this point, besides treating yourself with over-counter medication, is if your symptoms are not severe, meaning you don't have a high fever, you don't have shortness of breath, even if you have COVID-19, if your symptoms are in the mild form of it, actually all the hospital or urgent care will do if you go in is tell you to self-isolate for the next 14 days and also take all the over-counter medication that we've discussed earlier, to make your symptom feel better, because the only people, even if you're COVID-19, that needs to actually be managed at a hospital, a patient that are actually having trouble breathing. So I hope with what I say here, you guys understand that there's really no point to risk exposing yourself to actual COVID-19 virus by going to the urgent care and hospital if your symptoms are mild, even if you suspect you have COVID-19, because all we're going to tell you is drink a lot of water, take Tylenol, take any over-counter cough suppressant, Mucinex type thing that will help you alleviate the symptoms, and self-isolate for the next 14 days. And with that said, that will be the end of my current video, and I'll talk to you guys soon with a specific COVID-19 video in just a second, okay?